So, hello and welcome, dear colleagues out there, and welcome to our 24th episode, I think. So, I'm starting to forget about the numbers of the episode we are doing live, and it's a great pleasure to have with me or with us Markus Tröltzsch from Germany. He's not only I was thinking if to tell he's a doctor and a dentist, but the dentist is also a doctor. So so this is another this would be then another discussion that we could run. But hello, welcome, Markus, and it's a great pleasure to have you here because I know that you're also an expert on the topic, on the hot topic we are talking tonight about Corona. Although maybe a lot of people are sick now of all this Corona crisis, of all what's going on. But I think it's the point after 1 year of crisis to summarize some points and get some feedback from a scientific point of view, because there's so much nonsense information going around, and I think it's important to bring some highlights, to get some highlights, to get some facts out there and discuss them. And I'm really happy to have you here as a specialist, not only on this topic. So, Markus, tell us a little bit more about you.
Alessandro, thanks for having me. It's a huge honor to be allowed to appear in your famous series. Well, you went right into the topic. In my perception, dentists are the physicians of the oral cavity. I first went to dental school and added on top medical school. So I'm double degree. I went to Sydney to work a bit in the vascular surgery department, and spent some time in the maxillofacial department at the University of Zurich, and went back to Germany, did my consultant's degree. And now I am currently, or hopefully finally, with my dad and my brother in our private office in Ansbach, close to Nuremberg. We also run the local department for maxillofacial surgery at the community hospital. And I'm in the happy position to be leading the Academy of Postgraduate Training of the German Dental Academy.
Wow, that seems like a lot of jobs you're doing.
Like you're one of my epitomes, how one can organize its life, get a lot done. I mean, you run one of the most influential journals in the world when it comes to dentistry. How do you do that in your time while being a practitioner?
Yeah, look, the secret of, and I can share it openly with everybody. So you can steal my secret. So this is one of the main things on social media: steal my content idea, copy my ideas. So I can tell you, when it comes to this, it's all about being organized. And one of the key elements is called getting things done. Getting things done means everything you can do within 2 minutes has to be done immediately. And if you summarize all the things you can do in 2 minutes, it's answer a question from your staff in your office, answer a phone call, answer an email. I think 90% of all your work, of your daily work, can be done within 2 minutes, and the rest has to be organized, and then you find the spots where you do the work. And if you organize your workflow, your daily flow like this, so I have also a lot of private times. So there are some times of the day where I don't answer any phones, I don't answer emails, because they are for the family. And this is very important. I never mix my private life with my business life. And this was a lesson I learned several years ago when I started with social media. So keep the two things separated. Don't post private images on your social media account if you want. So then create a private account and have a business account. But it's very important for your audience to keep things separate. So be professional on one side. It's like when I work, I'm concentrated, focused when I do a restoration, and when I'm finished, I'm relaxed. And so my patients say, "You're always relaxed." Only when I have done my work. not the other, not the other way around. So this is my introduction on how to save time and how to get things done.
I couldn't agree more. That's, from my perception, the only way how we can tackle with everyday's work. And I think that's one of the specialties of being a dentist. Our profession makes us being a physician. Our profession makes us being an artist. And we still have to regard the science. And it's incredibly hard to combine that with entrepreneurial skills that we also need to run our offices. So for me, it's one of the most challenging jobs you can have.
So one question maybe to start the discussion before we jump really into the hot discussion about the coronavirus. So now it's almost 1 year that this pandemic never of us expected to happen, started. So where are we now? So what did you do? Or maybe I can add already the other question. What did you do with all the time you had at your disposal? So
you mean apart from drinking?
No, but this is so. So, for example, I started doing this YouTube and Facebook videos. I started doing or trying to search for new ways of communication, of education, talking to people, exchanging knowledge, not in the standard format we had before the crisis, just doing webinars. I think people are annoyed today to watch 1 or 2 hour webinars, and I think they should be replaced also in the future by more interactive sessions, so that we get prepared, online. You might also watch webinars and be more efficient. As I told you, in the big companies, the average meeting time, the duration of average meetings dropped down from 90 minutes to 15 minutes. So everybody took the chance to become more efficient during this crisis. So moving less, being more efficient, and I think we are experiencing a paradigm shift. It's for me, this pandemic is comparable to other big crises. Our generation never experienced a crisis.
Right.
So what did you do? What did you do in this year that you had almost? Okay, basically, we continued to work in our offices. We had this shutdown in Switzerland of 7 weeks last spring. So we were forced to stop working. I remember I have done 5 extractions in 7 weeks, which is not enough to run my business really.
No, not really.
So what did you do? What did you do in this year that you had at your disposal?
Well, all what you just said and the 2 questions that you gave me, they just align perfectly. Now, just 1 year ago, I just landed in Chicago for the meeting of the American Academy of Restorative Dentistry and met great friends again, had fun, and was listening the last time to a conventional international academy meeting, right? And I miss that. To be very honest with you, I miss the guys I met there. We have made online meeting sessions together just to compensate a little bit. Everybody on Zoom, just having a drink together and chit-chatting. But what really happened is that back then in February, there were great Italian friends also. You know Andrea Ricci, you know Lorenzo Breschi, and they all were there, and we were talking about something health-wise going on in northern Italy that's strange. I remember we were back on our flight towards Europe, and at the airport we were chatting about that. So that was actually one of the turning points. My brother and I have an eye on that, let's say, new disease. It's not really new, but it's a new strain. From end January on, as we had friends in Hong Kong who contacted us and said, well, there's something crazy going on, and people are catching a horrible disease quickly. So we slowly started preparing ourselves because we thought, well, it's an international world, right? We're flying all around the globe, everybody. And if it's as contagious as everybody said, it might come to Europe quickly. So we started reviewing what we could get, just getting a little bit prepared. We thought it's probably in vain anyway, but it wasn't, I think, because we were stuck with materials. We never had to reorder disinfecting agents. I think we still have enough supplies back from more than a year ago, like masks and everything. And we also followed our colleagues back in China who reported that the dental offices are getting closed down. You see, most countries in the world, dentists were closed down for a couple of weeks. Apart from like urgent emergency treatments, Germany is one of the very few countries that did not close dentists down. However, we had numerous dentists who were just running away from their offices, dropping everything and being gone. And I can be very honest with you. I was scared of that disease because a couple of my friends back in Asia, they caught that in January. And I could follow how severely that disease struck them down. And then a good friend of mine got the infection around beginning of March in northern Italy while skiing back from Göttingen. And he was in the ICU for more than 12 weeks in total, completely struck down and had a hard time recovering. So I saw firsthand experience how bad that can be. And I actually was scared treating patients. You have that patient in your chair showing clear symptoms of a cold that we still can't distinguish from COVID-19, but that patient has a huge abscess. Now, what do? And as we said in our beginning, we're not only there to drill holes and put some composites in there. We're the physicians of the oral cavity, so we have to be there for the well-being of our patients. And in countries where you were forced to lock down, of course you had no choice. However, in countries like ours, where dentists ran away from their duty and left other colleagues to treat their patients, I think that was one of the ugly sides of what we did. So first thing I learned is that the knowledge of medicine in dentistry can be supported a little more in the future. It's not the main fault of the dentists. Our education doesn't give us the background. Our dental training doesn't give us the medical background to actually distinguish viruses. Most dentists don't know that tuberculosis, for instance, always went through our face masks, always. There's no protection against that from our regular masks. For that, you need KN95s or N95s. Nobody knew that before. We always had a stockpile because we do treat tuberculosis patients here and there. Not regularly, thank God, but we do that. So first thing, we need to enhance medical knowledge among dentists. And that's one thing I did during that year. We were actually finally able to finish our book, Medicine for the Daily Dental Office, which became available in German in November. And we're right now working on the English translation as Quintessence was so supportive, and we're actually got to go for the international market now. So that was one of the biggest tasks we tackled. But if you compare where we were 1 year ago, we know a lot more about that disease. There are millions of people who caught that all over the world. And what we could learn from this is that our modern connected society is so extremely strong with the knowledge exchange and thus advancing each other's position that we can see how beneficial our modern world in these aspects at least is. So we know today that our normal masks, our surgical masks, are really from a clinical standpoint, not from a theoretical, but from a clinical standpoint, really safe. We know that ventilating our rooms is absolutely okay and very, very beneficial, not only for COVID-19, but also for influenza, for measles, you name it, all those infectious agents that always threatened us while we were working there. We have learned that actually locking down the way Germany is locked down right now is not beneficial. It doesn't help the same core. I'm very, very honest. 1 year ago, I was a big supporter of the first lockdown we went through. My opinion was always that there's absolutely no serious benefit in closing down medical or dental offices. As dentists, even more than physicians, have always been world-class champions of hygiene. Why? We're in the most hazardous environment the human body has to offer when it comes to infectious agents. It's the oral cavity. We're used to do that. We're trained in this. And our security precautions are so good that actually in China, although they were just wearing one-layered masks, still the infection rate was really, really low. So we know what we're doing. Second, we have seen that making the dentists shut down for a prolonged time, a couple of weeks, actually makes emergencies more serious. Well, you don't have to be Nostradamus to foresee that, right? And second, we also give oral cancers and all those chronic diseases, don't even go cancer, go perio. All those diseases, just take it, rock and roll, and if you see the patient again after 3 months, things are so much worse. So what did we learn? Locking down is wrong. Telling people that we need to distance, enforcing certain security measurements, such as masks, such as a certain distancing, such as not filling a restaurant totally. If you just use every second table, you'll be fine. We all learned that. But sadly, all that knowledge that we learned was not taken into action. So what really embarrassed me is how little politics learned. And what I did in the year of lockdown, actually, again, you were my role model. We looked into how we can advance digital education. How can we actually work with what we have? And I've done more than 60 online courses and lectures in the last year. I've done absolutely zero until April 2020, just to give you a comparison, right? In our academy, we have introduced a online conference format, which is about every second month, Saturday morning, a couple of hours, just specialists from several branches of dentistry coming together, chatting, giving the crowd, we have more than 600 to 800 people attending that, the possibilities to ask questions, direct, moderated questions. That's something I really love about this online format. Imagine a room of 100 people, 100 dentists listening to a lecture. Who actually gets the chance to ask? It's 2 or 3 maybe in a well-moderated session. Maybe they go through, collect the questions and assemble the questions, right? And ask them. Here, you can actually type your question into the chat and the moderator in the back can compile the questions and discuss that with the lecturer, and thus gives us a lot more information at the end of the day. So we used it to actually advance our abilities in online education. I used it to spend a little more time with my family, especially, as you just said, things have become more efficient. Time I just was spending on the tracks or the roads, I was able to spend with my family. I grew more efficient, and I tried to use every moment as much as possible.
Yeah, the thing really is, I know this sounds also a little bit, you can tell us you have to be more positive. It's not the thing of these gurus who tells you have to wake up in the morning, open the window, and be positive and think positive. But be positive in the sense of make the best out of this situation. So and also people who, maybe some people will say, you dentist, you can work. I'm running a restaurant. I'm forced to completely close, and my business will be ruined. I think we need to help those people. But on the other thing, let's go back to the story we started about the impact we had. And I think the term aerosol and splatter, was that term or the cause that closed all dental offices worldwide? So, what is the most dangerous thing in transmission of any disease? Aerosols. And who has the largest exposition of aerosols? Dentists and dental hygienists. So we have to close them down immediately. This remembers me when I was a student when HIV came up.
Yeah,
I
exactly.
really remember when the first HIV patients were treated at the university in Zurich where I was a student. So they really went into these rooms, isolated, wearing like astronauts suits, 5
Yeah,
gloves, and were afraid. Were really afraid to touch the patient because they thought if I touch the patient or I get close, I get infected. And
yeah,
I think
Johnson.
so. And also today we have to be reasonable. So we have to, because we are dentists and also doctors or nurses, we know that we have to run a certain risk when we treat our patients. But I think it's we can calculate the risk. And it's always a risk, as you stated in the beginning. We have so many diseases going around that, from my point of view, COVID or influenza are not the worst enemies we have in our dental offices. And again, the aerosol, and this is, I remember the first lecture, and I think you were the moderator of this lecture, of this professor from Wuhan, who,
No, it was
very
Frank
beginning
Schwarz,
of the crisis, I think it was in May, April or May last year,
April last year. That was
stated
Frank
that,
Schwarz moderating it. And
yeah,
Bilal
in
Anwar.
their clinic with thousands of people working, they had almost no infections or no infection that was really uh, from inside the office. And he already then questioned the role of aerosol in the transmission of the disease. So that's so to say people, and I know dentists who wear not, I don't know what special masks, and they also got infected.
Yeah,
The problem is maybe you will not get infected in the dental office because then you are careful, you pay attention, you get infected somewhere else. I remember a doctor who told me we had to wear all these masks, and I tell you where I got my infection. It was in the changing room.
exactly.
There's always a point where you go out. So you're diving, then you come out of the water, then you take off all your special equipment, and then you're naked, and then you are
Exactly.
exposed to all everything. So there's no way to get 100% safe in this whole situation. So this
No.
is, I think, a point about this aerosol and splatter discussion. I think the measures we have for many years in the dental offices are good enough. If we add wearing masks the whole day and all this other, that also our patients be aware to wash their hands, to not touch things, etc., etc. I think this is enough. But I think we should switch to another, because we already I have 20 minutes gone. So one thing that I really have to talk to you is, what do you think about all these conspiracy theories that are going around? And introduce this, I know many dentists who are telling me these weird theories of Bill Gates is behind that. In the vaccination, we will get microchips to be controlled by the Chinese, American, or Russian government. And then I answered one of these colleagues. I'm wondering if you have the same strategy when you work with your patients. So are you coming into the office and tell, oh, Mr. Tröltzsch, good to have you here. What's your problem? Yeah, I have small fractures on the upper right tooth. And then I tell you, oh, listen, yesterday I read about the conspiracy theory that every tooth that is fractured needs to be extracted immediately because there could be a chip inside. And how should a patient react to this? So I want to say, you can have conspiracy theories and talk to them with your friends in a bar or somewhere, but not in the public. I think we have the role to have judgments based on data. There's over the years, and I can tell you, I told you that there are many articles written. There are many articles already published about everything around Corona that has been found in the last, let's say, 2 years. And you should read that, and you should read the information from the official organizations. And there's so much misinformation around. What do you think about this?
Well, first, I couldn't agree more. I think we as dentists have a certain role. We're peers, and people expect us to have more medical knowledge than the average person on the street. Thus, we have to be a little bit careful with spreading conspiracy theories when it comes to health, because we are more likely to be believed. Second, the data that was acquired about COVID-19 is enormous. And as said, it fascinates me how great and good and profound the exchange about this disease is. And we have learned things. Things have changed, right? Right at the beginning of the pandemic, we thought hydrogen peroxide might be the best mouth rinse. Nowadays, we know that at least chlorhexidine or polyvidoniode are equally effective, maybe more. We'll see, right? This is a knowledge base that can shift. But the general information that we face a potentially very dangerous disease that has to be taken seriously. However, with our regular hygiene management protocols that we have been practicing for 20 years, we can safely navigate it. Now, this box, this is, I'd say, common knowledge since July by the latest, maybe earlier, but since then we're really safe on that. But the problem here is politics. There has been so much misinformation that has been spread, not for the better of the population, but to push political goals or to just overlay shortcomings of politics. At the end of the day, we are facing a mass of information. In Germany, we knew that masks are efficient. Yet, our Secretary of Health, one of the best we've ever had, irony off, quoted, "Oh, you mustn't use masks, they won't protect you anyway." The political idea behind that was there's not enough masks, so let's not force a run from everybody on masks so that there's a even greater shortage in the professional supply. However, that information is still stuck with the people. The same is with the values. What kind of value do we need to finish a lockdown? First it was 100 was acceptable, then it was 50, then it's 35, now we're talking even 10. I mean, we're talking about a respiratory virus. Even considering incidence levels of that is crazy. Why? Because we can't reach them in real life. We have a higher incidence of the normal coronavirus than the average population on an everyday basis. So why should we get so low ever? At the end of the day, the officials have demonstrated again how bad it is to mess with that, let's say, trust that people usually put in officials. If you look at the disastrous WHO statement from the 3rd of August 2020, where they actually claimed again that dentistry should be closed, where they claimed again that there's no protection in the general array of hygiene managements that can protect you from COVID-19, which was utterly false back then, right? And many things were just not written clearly and easy to misunderstand. Okay, human error in there as well. But at the end of the day, again, we learned that a straight and honest communication is the best method to prevent crazy ideas like, oh, you have now little satellites cruising in your blood after you got the vaccination. To be very down to the point, it's a potentially extremely hazardous infection that can also strike young and healthy. It's not limited to the elderly, and I'm sorry to say that so open because that's what people think when they say that. it's not limited to those people who will die anyway within 6 months. That is what people really think when they say that. But that's complete bullshit. I'm sorry to be so honest about that. Yes, those who are weak are a lot more endangered as those that are strong. But there comes a new player into the game, which we don't know anything about, and that's called the long COVID disease. I have several of my friends who are in their late 30s, mid 40s, who caught COVID in the first wave and who are completely healthy, sporty, right in their life, and who still, and now we're about 1 year afterwards, not back to about 60% of their performance levels. Their body is down. And you have to imagine, one of the first symptoms of COVID-19 is the loss of smell. Smell is nothing but little fibers of your brain going through the base of your nose. Right? So we're talking about a virus that primarily affects your brain as one of the first steps. Why should that be very, very easy on your body? So yes, we have a potential hazardous disease. On the other side, yes, a lot of people will probably catch the disease and have nothing more than a common cold and be well again, hopefully, although we don't know what later happens because the rumors, it's still only rumors because we're only 1 year into research of long COVID are rising quickly. And now you have a vaccination. A vaccination, now let's talk mRNA vaccinations. And everybody at the beginning said, well, it's a completely untested system. And you know what? Who was very suspicious in the beginning? Me. Me, here. I was at the very first situation, let's say in June, July, August, at the position. I said, wow, do I really want to have an injection of mRNA into, we don't know anything about that. Then, a lot inspired by my brother Matthias, because he's more the scientist of both of us. I'm more, I'm not even the face. I don't know what I am, but he's the brains. I'm the other thing. So he gave me some articles to read, and I went through them and learned, wow, this is not a technique that's brand new. It's actually a brilliant technique, but under research for several years now.
It was invented 30 years ago. So there's 30 years research on mRNA, and it's already used for other techniques, for other therapies in medicine, and now it's the first time that it's used for vaccination. So our older son working in the pharma industry told me, look, it's something new as a vaccination. There's always a 0 point whatever risk for anything we do.
Of course.
He told me 50 years ago we started building with asbestos, and everybody was thinking, this is wow, this is the innovation to revolutionize the building, the construction business and everything. And 50 years later, we realized, oops, this can cause cancer. But I don't think that mRNA will have these consequences because it's 30 years in development. And today, I think we are much further in medical research than we were 20 years ago. So you cannot compare a new vaccine of today with the vaccine of tuberculosis or measles or whatever the development started 100 years ago. So that's why at the beginning I also felt a little bit like, do I want this in my body? But the more I think, I would say I'm ready to take this risk, which is minimal from my point of view. And I think it's important that we tell everybody out there that everybody should get the vaccination, because this is in the strategy to go out of this crisis. It's the only weapon we really have. And we have no other weapons. There are some medications, but they are very expensive. But the vaccination is the weapon we have, and we should use it. We should really use it and go for it. And I don't understand if then doctors or nurses are telling me I don't want that because it's against my free will, I think in this situation there's no free will. So you have chosen to be a doctor, to work with patients. For 10 years, I'm doing the influenza vaccination, not because I'm afraid of influenza. No, because I treat a lot of old patients in my office. I want safety for them, not for myself. And this leads then to the discussion who should be vaccinated first. So I doubt that the strategy that we are doing, let's say in Switzerland and Germany, other countries do it differently. So in China, they start vaccinating the young generation, which I think is much better because I told you, now the older people in the elderly houses are vaccinated. The governments tell us, okay, everybody who's vaccinated can go to a rock concert and to a football game. So now the concert, the concert organizers or FC Bayern has to go to the elderly home to look for the fans because
Right,
they are the only ones allowed to go into the stadium. So
right.
I think it's important that we change the strategy and vaccinate as many people as possible. But I know that the problem seems to be that the governments promised to vaccinate everybody until in Switzerland they told us until June everybody who wants gets their vaccine. But I don't know how you see it in Germany.
Same promises, same lost promises. To be honest, what our governments did, this is not only true for Germany. I can assess it for Germany, but I just suggest it might be true for other governments as well, was a scandalous neglect of the preparation of the vaccination of the people. If you strip all medicine, everything, we take all the hospitals away, all the doctors away, all the emergency services away, all the pills away, and just keep up the vaccinations against the diseases that strike us in our childhood, our life expectancy will still be more than 100% higher than the life expectancy without these vaccinations. Because just training the human immune system to fight a disease is the best way actually to empower the body to help itself. Thus, the governments should have put all their efforts and also the reasonable financial means modern governments have into just pushing the vaccination capabilities. Nowadays, we're stuck in a lockdown. We don't even want to imagine the cost of that. And just if we calculate what the cost would have been to just pre-order enough vaccination for everyone in Switzerland, I'm sure it's way below the cost of maybe 1 or 2 weeks of a lockdown. So all the comparisons are lost here. From my perception, it would be extremely important to vaccinate those who have a lot of contact to other people first and who are crucial for our everyday well-being. Those who have been cheered to in the first lockdown, the people in the supermarkets, those people maintaining our logistics chains, but nowadays they seem to be forgotten, right? At the end of the day, the vaccination, just as you said, is our only way out there, regardless of what vaccination you get. I know there has been a lot of fuss about the AstraZeneca vaccination if we look closely into the science. And we have to say that both AstraZeneca and the mRNA vaccinations have had clinical studies with 40,000 participants. I mean, that's so above everything that we usually have on testing for pharmaceuticals or biomaterials in dentistry, right? There comes an attractive salesperson into your office and says, I have the very newest biomaterial here. It's so cool. It can do anything. Please buy it. And people say, yeah, cool. Great idea. Nobody asks about long-term testings. Nobody asks about the side effects. Although this will be in the patient's body for years and decades to come, that's something we have to discuss thoroughly in the allograft surgery thing. right? There's great science on DNA remnants and other cell remnants in allografts, yet it's huge out there and it stays there. And on the other side, we have people in our profession discussing, wow, I fear that the vaccination might grow me a third eye. Although if you just look into the literature, if you look into the basic bioscience of what an mRNA vaccination does, how long is that mRNA vaccination actually active? It's a couple of days to a few weeks. That's when we have to revaccinate again. Apart from that, your body has removed that totally. So there's this ambiguity, right? On the one hand, totally negligent to science. There's a few biomaterials on the market that have a broad knowledge base. However, there's tons of biomaterials out there who have absolutely no knowledge base and are still sold like marshmallows, right? And on the other hand, we discuss the sense of a vaccination. There's a cool sentence on the internet. Well, if you don't like the vaccination, please try the disease. So from my perception, we have not enough vaccines ready right now, which is a huge scandal, because it would have been possible maybe not to have totally enough, but to have a lot more. And our politicians are hopefully or probably getting away with that again. But anyway, that's number one problem. And number two problem is that, again, the kind of communication. If you would have told the public, yes, it's whatever we have here is long tested, has seen great trials. Yes, there's always a risk of side effects. Of course, you give somebody a shot that is meant to activate the immune system. Well, of course that has a side effect. Why not? So yes, there will be certain side effects, but from everything we can foresee, there's long-term potential damage, period. That should have been the official communication. Apart from that, it was hey and ho and maybe this and maybe that. No matter that the people are confused on the street. How could they not be confused? And what can we expect? Well, I hope we can expect that all efforts are being taken to vaccinate as many people as quickly as possible with whatever vaccination we get, so that we can get over that. But we have to be honest, somebody who is vaccinated can still transmit a disease for a very short period of time. We don't know how likely that is. For non-disease, that is absolutely researched. Neither for measles, any of the old diseases, nobody actually questions that ever. But yes, it's only logical that until your immune system reacts to the intruder, there might be a very short and tiny window where you might transmit that disease. But if the other person is vaccinated as well, there's no problem, right? So let's get people vaccinated as quickly as possible.
I have posted these trailers. I think the NHS made these brilliant trailers with Elton John and who was the actor, Michael Caine.
So Michael Caine, I love that trailer. It's so good. It's so
really
good.
Great. And the other story I heard this morning was the Vatican has forced now everybody living in this small country or this small, they have to be, it's mandatory to be vaccinated. If you refuse to be vaccinated, you will be fired. So this is to protect the Pope and to protect everybody. And I think this is also a strong message. This is, let's say, from the religious part. We will have a huge pressure from all companies. It's not even the states. So all the flying industry. So the companies, they say we will only transport people who are vaccinated. And so I think it doesn't need new regulations. The system, the global economy will manage this by itself. And I hear already people saying, yes, but I'm against this, and this is against my personal freedom. And I have to tell them, look, the personal freedom ends where it's not ethical to be personal free. If you potentially harm other people with your personal freedom, I think then it's egoism. Then it's not personal freedom anymore. And you can close yourself. You can close yourself in your home, or go on a mountain in a small house and wait for some years until everything might be over. I don't know. But on the other hand, I think now we really have to stand together and fight and do this together, go through it together. And again, for me, 1 year ago, I was very critical about this, but I think this is the strategy we have to follow, and we have to go. And hopefully we can get back to normal. But we discussed that already. What is normal after everything is over? I think there will be a new normal. For many people who tells me always, yeah, I want to go back to normal, go back to 2019. But industry doesn't want to go back. I think our profession, our business, our educational things will not go back to this. There will be new forms, and my statements are: we will get prepared for online or for physical meetings with digital tools. It's like if I want to go to the Nürburgring for a driver training, it would be helpful to do some driving before that. I'm get prepared to then go on the racetrack and perform better. And I think that we can reduce the time also of conferences. We don't need 4 days conferences. We can have them shrink down to 1 day or 2 days, but give people more information beforehand and also after the conference, creating a higher level of knowledge, of information base. And then it's even more interesting to discuss to people. If I tell you, okay, we will discuss about, I don't know, any surgical procedure, and I tell you, okay, look, there is 4 articles you need to read and to try to understand, and from there you get the questions out, and then you can ask the questions. Otherwise, you always have to start from I don't know. So this is my thing. I see as the result of the transformation we are experiencing in our educational world. Maybe I give you the last words or a final statement on what you see. So I'm positive. I think we see the end of the tunnel. We have the tools, we have the possibilities. Now we need to stay strong and keep on. Not like what I heard, that over Easter, the German, French, Spanish, and Italian governments, they want to open everything so people can go out. I'm not sure if this is a wise decision, but we will see. So I want to thank you for taking your precious time. I'm sure this could be an endless discussion about all this, but what would be your final for today? So it's a never-ending story. So I think we know that after 1 year, we see the tunnel. We have vaccination as the most important tool. We in our dental offices, I think we have established the guidelines, the hygiene measurements that are good enough. I don't see, or I didn't hear, even in the literature, that there's no really raise in in-house infections of dental professionals with coronavirus. The same was with HIV, with hepatitis, with all other more ugly disease. So I think we are pretty safe working professionals. So what is your thought on what's coming up in the next 6 or 12 months?
There's that very famous Churchill quote, and it's always good to quote Churchill at the end of the session, right? Never waste a good crisis. And that's actually where we are right now. it's a chance for dentistry to prove its role within medicine. Yes, there's still a lot for us to learn, but on the other side, we can also show how good our security standards are. We have learned, nobody's trying to shut down dentistry in the second crisis, right? Nobody touches that, because we all learned how negative it is to the general health of the population if dentists can't perform. We have learned more to use digital tools to enhance our knowledge and to enhance our learning, to have a new way. It's not new. It was always, not always, but it has been there 2 years ago, but it wasn't used yet. But to use the digital tools we have to enhance our professional and private life, become more efficient. And I'm not one of those people out there who says, oh, if you run a car, you're bad for the environment. But we have to be honest. I mean, if we cut down a little bit on commuting for things we can easily handle online, I mean, it would always be just of average to see you, Alessandro, live. But to be very honest, we were able to convey the same information tonight digitally without sitting next to each other. And we would have talked probably, I had the same chat if we were sitting next to each other with a room full of people. Now nobody had to commute, right? And these are all little stones we can actually use to enhance our life if we focus on the positive side.
Super. I couldn't have said it better or found better words. So thanks again for taking your time. Thanks to everybody out there who watched and listened to us. So maybe next time we can also do a podcast. Podcasts are now the other trend in dentistry. I have to understand why, but I'm more the visual guy, so I prefer to do a little bit. Show myself or see people face to face, but the verbal communication at least is also very important. So thank you very much, Markus. Thanks to everybody out there. We will be ready to answer some questions also for the people who ask the questions later on Facebook and on YouTube and on all other social media. So if you have anything to ask Markus or myself, feel free to do so. So I wish you all a safe journey. I hope that everybody gets vaccinated as soon as possible, because this will be the base of meeting